Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, March 1st, 2022. And our top story today, why you should evaluate and consider a long-term care insurance policy. Well, joining me now to discuss this and a lot more, Phil Snyder is a Senior Vice President of the L. Warner Companies, Inc. And I should also say that he's my father. You might notice the same last names. Phil, great to see you. Dad, great to see you. Thanks so much for joining us on the program this morning.
Hi, Jeff. Good morning. Thanks for having me.
Yeah, it's great to see you. And unfortunately, we still haven't seen each other in a while physically, but this is a great way to connect and happy to tap into your expertise in insurance products, et cetera. All right, Phil, let's talk about long-term care insurance. First, what is long-term care insurance?
Okay, that's a good place to start. Long-term care insurance is insurance that either provides reimbursement or direct funds to offset the cost or to reimburse for the cost incurred for long-term care services that are provided. Long-term care services are essentially standby assistance for people, primarily elderly people, but not exclusively so, who need help with what they call activities of daily living. Activities of daily living can include bathing, continence, eating, dressing, transferring, toileting, things of that nature that are brought about by either medical or physical distress or cognitive impairment, the most common of which I guess we all refer to as Alzheimer's disease. So these are relatively new products, probably no more than 25 or so years old, maybe a little bit older. But they're coming to the fore very much now as these types of expenses are becoming very, very costly. And we've got to find a way to meet them in one way or another. Yeah. So that's just a real high level overview.
Yeah. And thanks for that. And let's talk about at the age of 65, about 70% of individuals who reach this age. This is a heartbreaking stat. 70% of people who reach age 65, Dad, will need some type of care services, whether it's, as you described, something very in-depth or not in-depth. I mean, you really need to start looking at these types of products sooner rather than later, maybe even before my age. I'm going to be 50, as you know, maybe even younger.
I agree. This is really more of a planning issue than just an insurance issue. And it's a long-term issue. For people your age, Jeff, or people modestly older, these events are not likely to take place for ideally 20, 30, or hopefully never, but 20, 30, 40 years downstream. But the problem is you can't buy these types of products the day before you need them. You've got to buy them and plan for these type of contingencies in the future. What impact will they have on your finances? What impact will they have on your retirement planning if you get the retirement before you incur one of these issues? So these are matters that take a lot of thought and a lot of discussion.
Yeah, and how do you, from a process perspective, how do you buy a long-term care insurance policy? Do you buy it through your employer? Do you have to go direct to an individual insurance broker or a financial planner? What are some of the steps people out there looking or hearing what we're talking about saying, hey, we just lived through the pandemic. This might be a good idea to think about. I'm in my 40s. What do I need to do? So how do I get this product?
Well, let's talk about employer sponsor plans. There are several, but not many insurance carriers that sell group type employer sponsored long-term care benefits. They tend to be limited in their scope. They tend to be relatively affordable. I'd say most often they're offered as sort of a voluntary or an optional benefit to employees. They're not typically employer paid, but they are out there. But more commonly, you're going to work through some sort of financial advisor. whether that's an RIA, a registered investment advisor, whether that's an insurance broker, whether that's a financial planner. Regardless, that's how you're going to get access to this type of information and these types of products more often than not.
And in terms of the premia that you pay, right? I remember when you and I talked about this when I was a lot younger, in my 30s, and we were talking about this. You had mentioned that they had never, meaning the insurance companies had never raised rates. But it seems like with healthcare costs in retirement expected to be $300,000, the costs going up, the premia, even if you're in the best of health, Phil, that they've been going up. It's been going up.
Well, yeah, I think back to when I bought my long-term care policy, which was at age 50. And here we are, I won't tell you how many, but quite a few years later. And I bought mine from a major insurance carrier who's still somewhat active in that marketplace, although not as active as they once were. And I've seen at least, I'd say, 3 or 4 rate increases since I bought the policy. And I'm likely to see more because utilization is way beyond the initial expectations. And so insurance companies have the right under most freestanding long-term care policies to raise rates by petitioning their respective state insurance departments for rate increases. So I've just gone through another one over the past 2 years, and I'm anticipating there'll be more in the future. Having said that, the cost of my policy today, if I could go to the market and replace it today with equivalent benefits, would likely be 5 times higher than what I'm paying. So I still have a good deal, but if I were to go to the market today, if I could qualify and find a carrier to sell me a product, it would be 4 or 5 times higher than what I'm paying today. Very expensive.
Yeah, it sounds like it. Phil, I need to take a very quick break. When we come back, we'll talk about how the time is now for you to evaluate long-term insurance policies. And if it's right for you, you're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free for calling Annuity General today.
Call 800-504-8194.
Welcome back. We're talking this morning to Phil Snyder of the L. Warner Companies, Inc. And Phil is my father. You might notice the same last name if you didn't recall that, didn't see that. Dad, thanks so much for staying with us this morning.
Sure, Jeff. Happy to try and be helpful.
I probably should have asked you this at the outset, but after your description of long-term care insurance, but do I need to be extremely wealthy to have to want or need long-term care and to buy it?
Well, that's an interesting question, because I would say no, you don't have to be wealthy to buy this product. And the motivations for wealthy people buying it would be, I think, different than, let's say, average people who are, mid-income earners who have to give thought to how am I going to pay for possible long-term care needs in the future. So the products that are being offered today in any form are not inexpensive. They're very expensive. But that doesn't mean that you have to plan to insure 100% of what the likely costs or probable costs could be. I would say to people who have a relatively average means to address it as a component of how they'll pay for this future coverage. In other words, I may have savings, I may have retirement monies, I may have other financial instruments, for example, an annuity that I could use, or things of that nature to offset these costs. So consequently, you might want to look at long-term care insurance in one form or another as just a component of that overall plan, not funding 100% of what could otherwise be the cost, because these costs are going to be quite substantial downstream. Not to belabor the point, but I looked out 30 years and projected costs, for example, in my state, Maryland, and they're talking about nursing home costs in excess of $400,000 a year, 30 years downstream. They're already over 100,000 today. So just factoring in inflation, these costs are going to be staggering and probably well beyond the means of the average people for an extended period of stay. Yeah. So in the case of affluent people, highly affluent people, their motivations could be different. And that's a whole different conversation, I think, as to why ultra wealthy people might buy this type of coverage, or maybe they won't buy it.
Yeah, I mean, I wonder, and this is just a rhetorical question, I wonder if we pivot back towards the family members taking care of each other, as we did in previous generations. Dad, let me ask you about, for those asking the question about Medicare, Medicare Advantage, and Medicaid, do any of those programs cover long-term care, and how do they handle, if they do, how do they handle cost of living adjustments? Because costs do this. I mean, unfortunately, inflation's doing this right now, but costs do this over time. So do those programs cover what we're describing today?
Well, let's talk about Medicare. There is very, very limited coverage for long-term care services, which are essentially custodial services. They're really not medical services. There are people who need someone at hand to help them with the basic functions of daily life. And so Medicare provides very, very limited coverage. I won't go into detail, but it is not meaningful in the long term. Just enough post-hospital stays and things of that nature for a limited period of time. Medicaid is really for those individuals who don't have meaningful liquid assets to pay for not only probably just long-term care expenses, but just basic needs in life. These are people who need financial help, and they go to the states, the various states, and hopefully they'll qualify for Medicaid benefits. And if they do, then they'll find them the ability to get it to some type of facility or some type of services, whether they're home services, whether they're in the community, whether they're nursing home, assisted living, whatever the case may be, and they'll have little or no out-of-pocket expense because the state will bear that expense.
Yeah, I mean, it just
there are programs available for people with modest means. Right. Probably not as ideal as we'd like them to be, but at the same time, they are available.
Yeah, and it puts a lot of pressure on the states and the federal government financially. Last question, and this is not an insurance-related question, but I've also read that during the pandemic, a lot of long-term care workers, hundreds of thousands, have resigned. That's a big problem because if you need to staff up, you got to pay people a wage. Some have argued that the wage that people are getting paid, these long-term care workers, is not commensurate with what they're actually doing. just your thoughts on maybe how to bring down some of these costs. And it's a rewarding job. People like to help other people, but any thoughts there?
Well, I'm not intimately involved with, don't have a broad-based knowledge in that area, but obviously we need people to do this job and they have to be properly compensated. I think it's just as simple as that. You've got to, people who do this type of work are really giving type people. They're people who are oriented towards helping others, but then again, you have to adequately compensate them. So I think that alone is going to add to future costs of providing this type of care, which lends greater credence to planning ahead to figure out how I'm going to do it. Back to your mention earlier, if I can, just to digress for a second, Jeff. In an ideal world, in years gone by, family members would take care of those who needed assistance, at least to the extent they can, until I guess issues got so acute that they didn't have the capability, the knowledge, or couldn't allocate enough time to do that. But things have changed today. For example, you and your brother, your younger brother, don't live anywhere near where I live. So I'm not anticipating that you're going to race home when I need care to take care of me. So I have to plan for that. People are spread out in today's world, more so than before. And I think it's incumbent upon me and my responsibility primarily to create a plan to care for myself downstream, or how I will provide care. So it's just a planning issue, I think. Yeah. That's not to say that having family members care for you is not an available alternative. It's also not one, incidentally, that generally is reimbursable or paid for by long-term care insurance. So these people, you may compensate them in one way or another as family members, but insurance won't provide a benefit to pay them.
Yeah, well, this is, I think, very important. I think it's something that a lot of people don't think about. And look, the American consumer today is facing a lot of pressure, gas prices for obvious reasons, higher costs for food, etc. This is a can that I think you have to think about today. Phil Snyder, great to talk to you. Dad, great to see you. As always, thanks so much for joining us, and we look forward to having you back on the program again very soon.
All right, Jeff, thanks so much. Hope it was helpful. Hope to see you soon. Bye-bye. Thanks,
Phil. Great to see you. Thanks for sharing your perspective. That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest in lifestyle, finance, tech, wellness, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives and see our latest content? Check out our website and our streaming partners like Amazon, Roku, Samsung, and over 100 more. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.